Welcome to Chapter 2 of the exercise program for special populations. We'll be going over health appraisals and fitness assessments. Let's get this in slideshow mode. Just going to do it. All right. All right, we'll skip objectives because we're going to hit those. All right, so components of pre-exercise appraisals. We do pre-participation screenings through questionnaires or interviews to get information on health history and enable conception of safe and effective exercise programs for the client, and also protects the interests of the exercise professional. Okay, so what this means is we need to get as much information from them prior to getting going, because if they have any health risks, we don't want to hurt them. Also, we want to protect ourselves legally from doing something with them that would enable them to pursue legal action against us, right? And so that's why we have these screenings. And again, the screenings aren't 100% perfect, and they also rely on the person being 100% honest on the screenings. So, and again, it doesn't always help in not injuring the person, but as long as you go through your process as a professional and you just, and again, you accept that what they're telling you is true, if something does happen based on the fact that they didn't give you the truth, then that's not on you, right? And as long as you were following proper procedures and protocols, and again, not perfect, but this is what we use, right? It'll allow you to decide whether medical clearance is necessary. So again, a little bit different than if you work at the front desk of a big gym. So when you work at the front desk, people sign up, they can say, yeah, I've had a heart attack, whatever else. I smoke, I do all these other things that are not healthy for me, but I want to work out, therefore I'm going to, because they're not under any type of supervision, right? It's basically we have this facility where you're paying us money to have use of the facility in any way that you deem that you want to use the facility, versus when you're working with a fitness professional, they are now under your supervision. So that creates a whole new area of liability. So just understand that, okay? So again, if they say, if somebody comes in, they answer yes to any of those questions, they're just coming in to work out on their own. They don't have to go get to work out with you as a fitness professional. They do need to get medical clearance. All right. And then as well as be informed of potential safety issues and medications that may affect how the program is carried out. Again, sometimes the disease has its own issues with working out. Sometimes the medications and the side effects of medications can have issues. And so when they let you know that, hey, we're on this, and again, the doctor will say, look, I've got this person on this medication. Therefore, sometimes when they do certain things, they may get dizzy, or they may, their blood pressure may increase, it may decrease, like significantly, things like that. These are some things that could happen. Just be aware of that. Or they'll say, these are certain exercises or types of exercises that you may want to stay away from for their safety, right? So, all that information is good to have before you get going. So again, we do the PAR-Qs, which is a self-report assessment, medical history questionnaire. Lets you know of anything that they've gone through, anything that they're going through, surgeries, so on and so forth, right? Again, it helps you to realize where they may have some shortcomings or some things that you got to work around, or maybe some things that, again, if somebody's had, like a knee injury or ankle injury, they may have stability issues on one side that you may not only want to be aware of, but you may want to help them out with, right? And so maybe focus a little bit on some exercise in those areas so that they have full movement and confidence in the movements that they can do. The informed consent documents for the clientele. It says what is going to be done during a fitness test, what the risks are involved in. They basically read it and say, yes, I'm okay with it. Okay. Now, again, is a form consent 100% fail proof in legal matters? No, but it's pretty good. Again, you've got to do your part as being diligent when working with them not to do anything wrong as well, right? And the medical clearance is, if anybody answers yes to any of the questions on the Part Q, they're going to have to go get medical clearance. If they've had any recent surgeries or things like that, send them to go get medical clearance. Make sure they're orthopedic or whoever, whatever they're going to see a doc for. They'll say, yes, they can do these things. They're cleared to go, right? Again, kind of went over this, but it'll say what they can and cannot do, right? So medical clearance will say they can do all the following except, so they'll give you, things that are contraindications. Do not do these type of exercises. It may tell you they can do exercises up into a point that they may feel this, or this. So it gives you basically signs and symptoms to look for. And if you see any of those, then exercise needs to be stopped immediately. Or they'll just give you full clearance and just say, yes, they've had these issues, but they're fine. Just, normal workout is, you would with anybody else, right? So it's important to have that from the doctors. And again, do doctors always understand everything in fitness? No. But that is not for you to determine when working out with them. If you feel that the doctor was overcautious or was maybe not aware that this type of exercise can induce these type of things in certain people, so maybe like they shouldn't do certain, and they came back and they're like, no, I'm clear to do all that. Call them, and make them aware, like, hey, I'm not sure you're aware of this, and hopefully that they'll listen to you as a fitness professional, and they may say, oh, okay, yeah, I wasn't aware of that, or they'll just say, no, you just can't do this. And again, if you feel that the doctor's wrong, they have a license they work under. You do not. You follow what they say, because again, if something does happen, even if it's not really related to what the doctor said not to, or, like if you haven't do something the doctor said not to do for the reason, but let's just say, for instance, something happens, right? So they say, yeah, if they do that, they may have a heart attack, but let's say that you do it anyways and they break their leg, or say they do have a heart attack, right? So two different things. They could still come after you because they weren't supposed to be doing that in the first place. Okay, so just understand that. I meet so many fitness professionals that, again, you may be 100% right in that, yes, they can do that, but from a legal standpoint, it doesn't matter. Okay. Physically active clients who do not exhibit known disease or signs or symptoms of disease are not required to seek medical clearance, may continue with moderate to vigorous intense training, and may increase intensity as tolerated. Again, sometimes people have things they don't know, right? If they don't know, you don't know. It just is what it is. But yes, you can get them going. And again, physically inactive clients without disease or signs of disease may start exercise training with light to moderate intensities without medical clearance. Progressing intensity is tolerated. Again, you can, legally you can kind of start people wherever. Under a sense, as long as it's something that, like in the court of law, a lot of fitness people would be like, oh yeah, that's pretty normal. But you're always better, it's a weird tightrope to walk. You always want to err on the side of precaution, but you also always want to be pushing your clients to an extent, especially those that really are, they have really straightforward goals of weight loss or whatever else, and they're really wanting to get things moving, and you're, by you doing things very cautious and light, they may not be seeing things right, like it's this weird thing that you're going to go through. And again, the best thing to tell them is just be honest. Look, you've never worked out before in your life and you're 56 years old. We don't know how your body's going to react. We're going to be doing movements that you've probably never done before. You don't understand how hard this may be or how sore and you just need to have honest conversations with them and just say, look, I want to get you your results. I just want to see what your body is able and willing to do. And so I just want to err on the side of caution, right? So just, as long as you can get across that you have their best interest in mind and that you're not trying to prolong these situations so that you can make more money off of them because they'll have to be clients longer, you would think that they would be understanding about that. Clients who are physically active, have a history of cardiovascular, metabolic, or renal disease, but are asymptomatic are not required to receive medical clearance for moderate intense exercise if they have received clearance in the previous 12-month period. Again, if they have something shown that they're allowed to do that, if they've got, like some previous clearance. And again, if you don't feel 100% comfortable, call the doc and just say, hey, does this still stand? And they're like, yeah. All right. Physically inactive clients with a known disease but who are asymptomatic should be referred to medical professional for clearance prior to any exercise, because again, they don't know, they may be cleared, like they were cleared from their doc, but maybe not with the intention of them starting an exercise program, right? And so the doctor, you know, may say, hey, just be careful with this, don't do this, or, like just, like watch this in case they're doing these things and so on and so forth, right? Clients who develop new signs or symptoms of disease should be referred for medical clearance regardless of training status or the presence of disease. So again, you got a healthy client, so to speak, right? They've been working out with you for whoever, they could maybe like a year or so. All of a sudden, they've got this new problem, right? It could be anything from orthopedic problem, could be a breathing problem, could be a heart issue, like they're getting weird heartbeats, whatever else. Then you go see a doctor, and you don't really want to be working out with them during that time. I mean, you do, but you don't, because again, you never know what can happen, right? So you want them to get cleared. And again, if you were aware of it and if they were aware of it at the time, they can be like, oh, well, yeah, he or she knew I was having these issues. Great, right? Now they may have some legal action against you. If the client is presently engaged in an exercise program, it must be discontinued and medical clearance should be obtained before for recommencing any exercise program. After clearance, inactive clients displaying symptoms of disease should initiate exercise at light to moderate levels and progress as tolerated, right? A lot of saying the same thing over and over. They're trying to get it in your head. Parameters for exercise intensity: light intense exercise 30 to less than 40% VO2 max, or heart rate reserve 2 to less than 3 METs, 9 to 11 on the RPE scale, or 6 to 20 on the Borg scale. I think it's the different scales. If you're not familiar with those, they're a little bit different. So like the Borg scale, basically 20 is supposed to be at the Borg scale that they're doing this 9 to 11 RPE means that like at 200, theoretically your heart rate would be, at 20 your heart rate would theoretically be at 200. At 6 your heart rate would theoretically be at 60 beats a minute. So again, the 9 to 11 would be 90 to 110 beats a minute. Now again, it doesn't work quite perfectly. It's kind of a, nobody's sitting there like, I think I'm about at like 80 beats a minute, or, it doesn't really work like that. You can do the 0 to 10 scale. A lot of people, when you do this one, sometimes it confuses the clients if they've never done it. This is why we use it, because of theoretically what it's supposed to represent. You can do the 0 to 10 scale if you want. The other one is you can use the talk test scale, which again, if you can carry on conversations with them, they're in the lower end, right? So if you can sit and talk with them and they can talk back, and even if they're kind of taking, like they take a breath, but they'll talk like I'm talking now, and able to carry on full conversations, they're kind of on the lower end, right? If you get to a point where they're giving you, like a lot of breathing And then really short sentences, they're kind of in that medium range. If they get to the point where they're only giving you like yes, no answers, or really, really short, direct, like, you ask them what they're doing after they work out, and it takes them like, like about 6 breaths, and they're like going to the movies. Then they're at the upper end, right? Again, it's a lot. I feel it's a bit more of an objective. Now, again, you've got to learn to interpret the talk test, and again, you've got to get familiar with it, but it's a little bit more objective than the subjective of them trying to figure out like where they think they're at. Because like I've said, I've got, like I've had some folks in my class that are like ex-military vets, man, and they're dying. They're just straight dying. And you're like, okay, where are you? And they're, on we'll go to the 0 to 10, since most people are more familiar with that, because I could ask them on the Borg scale and they're like, oh, I'm at a 6 or 7, or on that one, they're like, I'm at a 0 or 1. I'm like, dude, this guy's like 30 seconds from like passing out, right? Where you get some other folks who are not used to going through tough things, like they're just fine, and you ask them where they're at, and they'd be like, I'm at a 20, or I'm at the 10 on the 0 to 10 scale. And you're like, we just turned the treadmill on like less than 3 seconds ago. This is like you walk into the bathroom, we're not even doing anything yet. I mean, and again, it's very subjective, but some people are just not used to any type of discomfort, and other folks have been through hell and back. So it's very subjective to the person, and you're not, a lot of times it's hard for somebody to be like, 100% honest when it comes to that, because they really don't know for themselves. Moderate intensity, 40 to less than 60%, 3 to less than 6 on the METs, 12 to 13 on the RPE based on the Borg 6 to 20 scale. Intensity producing noticeable increase in heart rate and respiration. So again, this is that medium where they're not wanting to just sit and carry on conversations. They're like a little bit more choosy about when they, like, how much they're going to say and what they're going to tell you. If we do the talk test, vigorous, this is greater than 60 up to 90%, greater than 6 METs, greater than 14 RPE, substantial increased heart rate, respiration rate, which means this is where you get the really, really short answers, mostly yes or no, or what they're going to probably want to talk to you about. You may just get head nods with some folks. If they can't talk at all, you may want to back it down, especially if these are folks who are not used to like really working out. In some cases, even after medical clearance, medical supervision may be recommended. Some folks that have really bad hearts or breathing problems, they may have to work out in clinical settings. They're just high risk. They've got to have on a, we call them ECGs in our field. You guys, are probably more familiar with everybody else that, like they'll hook them up to an EKG monitor while they're doing stuff. But if you're ever in a physiology lab and they're like, all right, hook them up to the ECG. That's what it's same thing, ECG, EKG. Again, they're just high risk. And again, you want them to be monitored by, fitness and health professionals, sometimes simultaneously. And again, if they're at those type of settings, if something does go wrong, they're going to have a lot more resources to help them versus being at a typical gym, right? If medical supervision is not necessary, professional supervision may be prudent. Again, use a fitness professional, should know how to supervise assessments and exercise programming, things to look for, especially, like if you have somebody with an issue, maybe you're not really familiar with it, familiarize yourself with it, look for signs and symptoms and everything else of like if something's going wrong, okay? Rationale for fitness testing includes establishing a baseline to track progress. Again, You're going to hear me go back and forth with fitness testing, what I like and dislike with it. There's a lot of things I like. I think there should always be some type of fitness testing. Again, doesn't necessarily mean the person needs to know that you're testing their fitness. You can actually get somebody going sometimes with a routine, and you're basically the first things that you're doing with them, you're just taking notes on it, like, okay, they can only bench press, like 100 pounds, or they can only run at a speed of 4 on the treadmill for like so many minutes, or like whatever it is, that actually 4 is not even running, you got to be at 6 for it to count as running. um those type of things. Or you can make it more formal, where it's like, we're going to go through a battery of tests. Okay. um Depends on the client, depends on in so many regards. Some people get nervous doing testing stuff, so maybe it's not a good idea. Some people just want to get going right away, so maybe not a good idea. You may have somebody that's more of an athletic mind, and they like to do the test because they, like, in a month they want to see if they can break that record or with something like that. So more important in those situations. Or maybe they need those, those for, to show their doctor, whatever it is, right? There's reasons for more formalized testing, and there's reasons for having baselines that are somewhat like a test, because you can always go redo those exercises again, and you're probably going to be doing them through the time period that they're working with you, but you can actually formally check the numbers again, so somewhat like, or informally check the numbers, I guess, and show them, we're like, hey, this is where you were, this is where you are, right? So again, important in that regard, identifies current levels of fitness that will contribute to the exercise program. Again, kind of helps you to figure out like what you probably need to work on with them, like what's their strengths, what their weaknesses are, things that you need to look for while they're doing certain things. Establish appropriate exercise selection, frequency of the exercises, intensity, volume, so on. And again, you can do that through an informal or formal. All right. So it's really discretion up to you. I know some folks that are really hardcore, like you got to do like legitimate assessments all the time. I 100% disagree with that mentality. You got to treat each client as, you always hear people say, like a unique flower, or a unique snowflake. I mean, really it is. Unless you're coaching a team, or you're coaching a group of folks, you really need to treat each individual client that comes in as unique. And if I was going to pull through your files of, say, you had like 10 clients going at the same time, I would expect, if you were a good trainer, I'm going to find 10 different exercise programs. Like, and again, they'll have some similarities. If you have people that come in at the similar, they're in a similar situation, they have similar goals, or, like so on and so forth, they're going to look similar, but I better find some differences in there, because different people have different needs and wants, and so on and so forth. And you got to approach them differently, right? So again, don't get stuck on some things like, oh, no, you always, no, you did. Remember, in fitness, there's nothing that we have to do. Okay. When it comes to exercise, there's nothing that we have to do. There's a plethora of tools that we can use. Okay. um yeah, and there's, even if you have people that have the same goals in mind, but they have different ways that they feel comfortable going about getting to those goals, there's a million, there's a million routes to get to the top of the mountain. Let's just put it that way. You can traverse the north face, you can go this, go off the south slope, whatever you want to get them up there. Okay. So again, this will help develop short-term goals. So things that you'd like to see in the immediate future where they improve, some things that you'd like to see in the next few months, to maybe a year. And then long-term fitness goals, like where do they want to be, like in a year or more, right? Depending on what they come in with, sometimes long-term goals might be within less than a year, and they're just going to keep certain things up. Some people, it's going to be at a year. Some folks, because of they're in such bad shape, it's going to be multiple years before they get to hitting that long-term fitness goal, right? Identification of clients' needs and limitations before the exercise program and initiation. Again, huge, because you got to know what they can and cannot do, what they can and cannot improve on, right? They may have certain things that you got to work around, you can't work through, or you can't work to improve. And that is what it is. Okay. And again, you don't have to have formal assessment to do that. It can be a combination of working them through some common exercises that you two have agreed on that they should do, and they're like, this one kind of hurts when I do it this way, and you're like, okay. Is this, and again, you determine whether it's something that you got to avoid or if it's something that you can help remediate and help fix with them, right? Establish a method of recording decisions regarding appropriate scope of practice in case the client experiences an injury or an exacerbation of a current medical or health condition after the program begins. Again, very important. We don't want to hurt them, or cause any more issues than what they came in with. Fitness testing results must be put into context in order to provide guidance for the goal setting. So it's like, okay, here's where you're at. Because again, you get some folks, they come in, they're in horrible shape and they're like, spring break's coming up and I want to look fabulous. And you're like, okay, what's fabulous? And they're like, I want this body. And you're like, okay. Which spring break is this? Because we're coming up on 2021, and realistically, we could have you looking fabulous by 2023. I mean, it is what it is, right? And so, some people have these crazy goals. It's like, some people have crazy goals that are doable, and some people have crazy goals that it's like, no, it's not doable. Or if we even attempt it, it's putting your life in danger, right? So again, sometimes you got to help them reestablish the goals or help them establish realistic goals, right? Properly standardized tests will yield results that can allow clients to be compared to either to their peers using percentile rank norms or some established standard for health. Again, another one of those arguments for doing fitness assessments, like the formal fitness assessments. Some people want to know where where do I stand in society? Where do I stand with my peers? Where do I stand with folks that are into this sport or whatever else? And again, like I said, some people think I'm against things. What I say is, no, with some clients, I'm like, no, we're doing tests. They need it 100%. With some clients, we're not doing standardized tests. They need not to do them 100%. Okay. That's just how it is. Right. Regardless of the standards used, clients can still track their improvements by comparing later scores to initial ones. This is what I was talking about earlier, right? And it improves their self-confidence and motivation. Like I said, some people, like if you talk about like, hey, we're gonna do some testing, man, it's gonna put them off, right? That's not why we're here. We're here to help them, all right? We don't need to put everybody through a test, okay? It's important since standards for disease or disabled individuals are lacking, often reaching preset goals is the only source of tracking progress. Again, sometimes because somebody has certain issues, they can't really do the standardized tests and things coming in. So that's another reason with some folks, you may not really want to do it because again, you can't really get a full, like the full picture and rank them or whatever else, okay? In disabled disease populations, it's important to select appropriate fitness test, and it is the exercise professional's job to recognize how a given condition may require alteration of standard assessments. Again, improvision is key. Don't be these fitness folks that are set in their ways. Look, I squat, I deadlift. Not everybody needs to be squatting or deadlifting. I know there's this thing in fitness sometimes we're like, look, if you're not doing your core lifts, what's the point? Squat, deadlift, bench, whatever, right? Not everybody has to do those things. Again, if somebody's just trying to lose weight or whatever else, there's no reason. They don't even have to ever come into a gym. I'll say this 1,000 times, man. If I get somebody, they're like, yeah, I've been really interested in surfing. If I can, look, if I can surf and I can meet them out at the beach and teach them how to surf, and I just keep them out there like paddling out and surfing back and paddling out and surfing back, and they're loving it. And they're like, you're like, hey, so how did you like your exercise? And what, we're exercising, man? I was just having a blast. Are you tired? Hell yeah, I'm tired. I'm like, do you really care about going to the gym? No, I don't really care about going to the gym. And they're, after time, they're losing weight. And it's like, are you reaching goals? Yeah, I'm reaching my goals. What's the, this is what I argue all the time. Look, I'm a gym rat. I am. Like I said, I deadlift. I do all those things. Squat, I bench. You name it, I've done it. But I'm also, like if I had time, resources, opportunity, like for my cardio, and yeah, again, I'd run all the time. But if I had a group of guys that are like, hey, would you rather go long distance running, or would you rather go play basketball with a group of guys every day, or guys and girls, and like really run it out for like an hour or 2 hours? Man, I'd much rather do that. That's way more fun. And if I can get a good, like if I can get good cardio going and everything else doing that, and I've got the time to do it, heck yeah. If I got the time to get to the beach and go surfing all the time, heck yeah, I'd rather go do that. I mean, it's more fun. Um, and it can be just as good or better. Sometimes when people are having fun, man, they give more effort, right? So don't get so stuck in the ways of like, like we have laws and rules and regulations when it comes to what people are going to do to reach goals, because no, we don't. Okay. Client's maturity level, chronological age may also affect their test performance, right? You got that kid that likes, digging for worms and chasing butterflies. Man, you can't sit there and ask them to do complex tasks, right? Where you have somebody that's got diminished mental capacity as they age, they can't ask them to do complex tasks, right? Similarly, appropriate tests must be selected based on gender specific differences. Again, look, this is not a non-feministic view, but men and women are different. We are built different. We have different physiology. I get some folks that when they go through these textbooks, they get a little up in arms with this stuff. Look, this has nothing to do with equal rights, equal pay, any of those other things. This just has to do with the physiological differences between men and women. Okay. And it is, right? So again, when we have, because of that, when we look at physical standards and things like that, there are different recommendations for how many push-ups put you in the 90th percentile for men versus women, or that women can do, like you got a standard with regular push-ups or with knee push-ups, right? Men only have the regular push-up standards that we do. Those are some of the things that you'll see. Okay. And it just is what it is, right? Because physiologically, for the most part, yeah, most of us are very different, especially once we've gone past puberty, right? Now, in little kids, there's really not much of a difference. Prepubescent kids, boys and girls, well, physiologically, they can do the same thing. Girls are usually a lot better at that age. Like if you have a 6-year-old or 7-year-old or 8-year-old, like if you look across the board, because little girls versus little boys tend to be a lot more mentally mature. In the sense that they will pay attention better. You can actually usually give them more complex tasks versus the little boys of their counterparts. Again, it's not 100%. I know some little boys that listen well and can follow directions, and I've met some little girls that cannot. But when you're looking at the 80-20% rule, right, Pareto's law, that just kind of is how it is. Test order. We do non-fatiguing tests first: height, weight, resting heart rate, resting blood pressure. We'll do flexibility, body comp, and anthropometric measurements. Next, we do agility. Then we'll do strength. Then we do local muscle endurance. So this would be like push-up tests, things like that. Strength difference. Sometimes people, I guess I should explain that. Sometimes people don't know. So again, agility is looking at like, how quickly can you do like movements in different directions, so to speak, right? Again, if you're doing The other thing is too, is if you're doing power movements, those will go prior to the max muscle. You can do them after agility. Sometimes it's better to do them after agility if the agility is not very taxing, like if they're doing short burst stuff. And the reason being is it kind of helps to warm them up. If you think the agility tests that you have them doing might affect the power tests a bit more, what you may want to do is just have them do warm-ups, then do the power test, right? But again, agility is usually a good one to do just prior, because, and again, especially if you have some time in between where they get some rest. Then we do max muscle strength. Strength is just like how much can you lift, right? I mean, that's the 1 rep max. Muscle endurance would be like they show partial curl up, which is, like a sit up type test or push up test or something like that. Like, how long can you do, kind of the same movement. Like if you do bench press versus push up, same movement, one's looking at like what's the overall amount of muscle strength you have in a 1 rep max versus how many push-ups can you do, right? Muscle endurance. Then we have cardiovascular endurance. Again, we do that at the end because that's usually the most taxing, right? And you don't necessarily recover from that as well as the other ones, okay? And it would have the greatest effect on how they do on the other tests. So we typically go on those. Testing protocols, track a client's progress towards their predetermined goals is crucial because you want to make sure you're taking them in the right direction, right? And again, it helps motivate them. If they see that they're going in the right direction, they want to continue to do it, right? And again, the test that you do needs to have a certain degree of accuracy, right? So again, if I'm always testing you like on your strength and your power and all that stuff, but your goal is to be a great basketball player, yeah, you may be seeing great gains there, but if we're not working on basketball skills and agility and things like that, you may not really see it translate onto the court, right? So again, accuracy. Accuracy of fitness testing depends on the ability of the exercise professional to select proper tests, properly explain the procedures of those tests, prepare the client to successfully complete the tests, and carry out protocols properly. This is really important because if you get into NASM and ACE and you see some of the ways that they want you to carry out functional assessments, you'll see that this is basically in complete contradiction to what they want you to do. Like, for example, you give very little instruction to somebody doing an overhead squat with a bar, or there's some step over tests and some other tests that you do for that. They basically have to, you give them a very simple instruction. This is how you do the overhead squat. And then you watch them do the overhead squat. Okay. So those of you that have never done squatting or overhead squatting, just to give you an idea, squatting is difficult enough. Any of you that have ever, if you've ever learned how to squat, it takes a while to master squatting and have good form. It's very hard as a fitness professional to teach squatting to some people. I've actually had some folks that, are amazing, but more than not, it's usually difficult. And then on top of it, an overhead squat is even harder. So using that as a assessment to look at whether or not people have too tight of muscles or too weak of muscles, or they have this problem or that problem, when more than likely the reason they perform that test incorrectly is just because they don't know how to correctly do it. They've never practiced it. It takes mastery to do. Okay. Again, this is the opposite of what they're telling you, that they want you to select the proper tests, explain the procedure, prepare them to successfully complete. Like you don't want them to fail on the fact that they just can't do it correctly based on lack of knowledge and lack of ability. If they can't do it, we want it because we want to see, 100% there's some physical issue going on that is, that you can, without a doubt, that's why they're not completing the task correctly. Okay. And again, way different philosophy than what I've seen in NASM and ACE in recent years. Resting heart rate. Have the client sit comfortably for 3 to 5 minutes. Palpate radial pulse using tips of index, middle finger. Count the number of beats in 60 seconds. I like the 60 seconds better than, doing 30 seconds and doubling or 15 seconds quadrupling. The reason is because sometimes when you do that, you'll find that the 30-second double sometimes might be a few beats off, or the quadruple might even be a few more beats than that off. It's just, you're wanting to get beats per minute. It's the most accurate way to do it. Now, when they're exercising, it's not as easy to sit there and try to hold on to them for the 60 seconds. So, again, sometimes during things like that, or in between like reps or sets or things like that, we'll do it. The 15-second time, because that's, it's just the most feasible at that particular time juncture. Exercise professionals should not use thumb to measure heart rate due to the independent pulse that is in your thumb. Again, nowadays, a lot of people have a lot of wearables that do their heart rate, whether you have like a Apple Watch or a Fitbit or whatever else. So sometimes doing this is not necessary. They can just flip on their device and tell you. Resting blood pressure, position, climb upright, seated posture with the back supported, legs uncrossed. Select appropriate size cuff, locate the brachial artery. Again, place the cuff in the sphygmomanometer. Sometimes I get that one out good, sometimes I don't. On the upper arm in a manner that covers the brachial artery, and with the bottom of the cuff approximately 1 inch, 2.5 centimeters above antecubital space. Again, this makes more sense when we do this in a lab. So hopefully you guys have all done the assessments labs in the lower division courses. If you don't feel comfortable, we can add this to our lab for this course. Okay. Cuff of the sphygmomanometer, say I got it that time, should be placed so that the dial or display is readily viewable. Taking the measurements, the bell of the stethoscope should be firmly placed directly over the antecubital space. The client's arm should be level with the heart in a horizontal position. Inflate the cup rapidly to 160. I usually try to take it up over 180 to 2, just because sometimes people have really high blood pressure these days. So taking it up to, like, around 200 is just, I think you're covering your bases better. You'd be surprised how many people might have a resting systolic blood pressure above 160, right? So, they said or 20 above, they're known, but a lot of times people may not necessarily know, or they don't. I mean, you go up around 200. Again, it takes you longer to do it, when you're letting the air out, but is what it is. Then you release the pressure from the cuff at a rate of 2 to 3. I always forget the mmHg. Anyways, per second. Systolic. So again, if you let it out too quick, you're going to miss it. You may miss the first Korotkoff sound, or you might miss the last. It's just do it slow. Some people get in this hurry. Just do it slow. I've been where, like, nurses and medical assistants and doctors' offices, they screw up they'll screw up my resting blood pressure, and they're like, wait, this can't be, and they have to do it several. I have one of my Korotkoff sounds kind of hits weird, and when they do it slow, they hear it. But yeah, when they get in a hurry, they screw it up. So no, there's never a reason to be in a hurry on something that you don't have to be in a hurry on, right? You don't get points for getting the blood pressure done in under like 10 seconds. Okay. So again, systolic is your first audible Korotkoff sound. A lot of times you'll see it tick too. If you see a tick but don't hear it, it doesn't count. You got to have both, right? So the sound is what we really go off of. Okay. And then diastolic is recorded as a disappearance of all Korotkoff sounds, or in some physiology textbooks, it'll be the fifth. Your fifth one is usually your last, but some people may have like 6. Some people, you know, if they have six or like they have more than five, you're supposed to go the first and the fifth. But again, and you'll know, I like if you hit number five, and you notice that it's at, like say they have a pretty normal systolic, and then number five falls in a normal range of diastolic, and then number six hits, or they have a 6-7 and it's like down in like 20 or something, like just saying, right? It's probably the fifth, right? So again, I think it's where you get in these physiologists are like, no, you do the first and the fifth, where other folks are like, no, do the first and the last. Again, playing the odds, they're probably going to both will fall in that, but is what it is. Record systolic and diastolic blood pressure in even numbers. Body weight, have client empty pockets. Again, basically, you want to know what they measure, not what they measure with their like combat boots and like heavy clothes on, right? Have them in, like again, you don't have to strip them down naked, because again, if you're going to measure changes throughout the time, if they're going to wear basically the same type of clothing each time that they're in there, again, I wouldn't do shoes because, maybe they're in some workout shoes now that only like weigh this much, but then they change to some other ones that are heavier or some other ones that are lighter, so just get them down to their socks. If they're always wearing shorts and a tank top and they're always going to be wearing shorts and a tank top, then fine, right? You can just leave them in that. Height. Again, we take their shoes off so we can get their exact height. You should know how to measure height. Lung function. This just a lot of people don't really have any way to actually do this. There you can get those little plastic things that you can have them breathe out. If you've got a VO2 machine, that's great. It's awesome if you have a spirometer and all that. But a lot of gyms aren't going to necessarily have that. So this is probably one that you more than likely will not do unless you work in a more clinical setting. Again, VO2 max, you're probably not going to be able to do. Submax, we can do just, you just need a treadmill or a bike and you can do submax testing. Again, it's not very accurate, but it kind of gives you an idea. I mean, it gives you kind of idea if they're in good or bad. But it's not going to be super accurate. Anytime you do submax anything, it's never super accurate. Whether it's this type of testing or a submax one rep, submax for a 1 rep max projection is not very accurate. So again, if you have anybody that's got any major medical issues, you're going to do submax tests and you'll do the modified test for a lot of folks. And some folks, you won't even be able to do those tests, right? Test termination criteria. They have symptoms of angina, so chest pains of any type, systolic blood pressure drops more than 10, extreme increase in blood pressure again, or systolic blood pressure is now over 250 or diastolic over 115. Client experiences shortness of breath, wheezing, leg cramps, other symptoms of claudation due to inadequate blood flow to leg muscles, taxic, dizziness, pallor, cyanosis, cold or clammy skin, nausea, any of these things that show that they may be going into some type of medical emergency, you're going to stop, right? And you're going to call 911 if you have anything on these ones. I mean, besides like leg cramp, that could, you can wait that out. Shortness of breath, depending on like, is this like, they're just out of shape, shortness of breath, or is this like, say, you sit and talk with them about those. Heart rate fails to increase with increasing work rate. That is a scary sign. They're like working, they're trying to work hard and it's like, your heart rate hasn't gone up, right? Heart rhythm changes. Again, their heart rhythm should be going up as they worked out. So that's not what they're talking about. They're not talking about the speed of it, but they go where they're like having weird arrhythmias, or they get into like, if you're actually looking at, like if you're looking at an EKG, all of a sudden, you know, it's like it looks like they're in some type of tachycardic state, you know, versus just having fast rhythm because they're working hard. Client asks to stop the test. That's the thing. They have the right to stop anytime they want. They have any physical or verbal indication of severe fatigue, and you think that something serious may come shortly, and testing equipment malfunction, right? You got to stop it. Okay. Testing guidelines for cardio, heart rate, and blood pressure should be taken immediately before the test. In the same posture that they will be doing the exercise test. They should be familiar with the mode of the exercise. Again, you know, if you really want somebody who's cardiovascular, so say you got a long distance runner, don't put them on a bike. If you have a cyclist, don't put them on the treadmill. Okay. An adequate warm up of approximately 2 to 3 minutes should be completed before the exercise test. We don't want to like get them to start kicking butt from a cold, you know, like cold muscles and ligaments, tendons, those type of things. Every protocol use should consist of approximately 3-minute exercise stages. Again, you know, you can use all the protocols pretty much that you use do those things. There are faster protocols. We usually use those with folks that are in better shape though. Heart rate should be, you know, like time to exhaustion ones and stuff like that. Heart rate should be measured a minimum of 2 times during each stage. Near the end of the second, third minute of each stage. Blood pressure should be measured during the last minute of each stage. Again, sometimes we do blood pressure, sometimes we don't. Okay. RPE should be taken near the end of the last minute of each stage using appropriate scales. Exercise professionals should monitor client for signs and symptoms to terminate the stage. Again, you should be always paying attention. Don't play on your phone. Following tests, categorize client's endurance status using the standards that you have. Again, treadmill tests. You've got the Bruce treadmill, which you start slow speed, but relatively steep incline every 3 minutes. Both speed and percent grade will increase until they can't go anymore. The bulk wear treadmill test begins at a speed of 3.4 and 0% grade. The speed of the treadmill does not change again during the test. And at the beginning of the second minute, the grade is set to 2%, and then it's increased by 1% every minute until they get tired. Okay. Estimate the VO2 max for Bruce or bulk wear. The exercise duration spent during the test should be used in one of the equations from the tables in the book on 2.4. YMCA step tests, set a metronome to 96 beats, which is 24 steps per minute, and the stopwatch to 3 minutes, and instruct the client to keep pace with the metronome by stepping up on a 12-inch box or bench with the right foot, then left foot, then stepping down with the right foot, then left foot. And the client will practice stepping in time to the metronome so they know how to do it before they start. After time expires, have the client immediately sit down, take the pulse for 1 minute, and score based on their heart rate. Now, here's the issue with this one. I'm 6'2". If me and a shorter person at 5'2" do this test, and say we're at the exact same physical, you know, like say we say that we really are at the same VO2 max, this is going to be an easier test for me because the step up is 12 inches. 12 inches for somebody at 6'2" is less rigorous than somebody that's 5'2", right? Again, not a big fan of the YMCA step test because we don't change anything based on the size of the person doing it, right? Recumbent stepper. Again, we won't do this one in the lab because we don't have a recumbent stepper, but again, they're required to maintain constant step rate, 100 steps per minute for the entire test. Work rate for stage 1 is same for all clients, 3 watts. Subsequent work rates are assigned based on heart rate response. Heart rate should be taken during the final 10 seconds of minutes 2 to 3 of each stage to determine if steady state heart rate, a change of no more than greater of plus or minus 5 beats per minute has been attained. Again, You guys can read through the recumbent stepper. We don't have one in here. It's one of those, it's not a real accurate test. Not a lot of people use it. They'll kind of use it with folks that they're a little worried that they can do anything else with them on. Cycle ergometer, YMCA cycle ergometer. Got to maintain a constant pedal rate of 50 RPMs for the entire test. Work rate for stage 1 is the same for all clients. And again, basically the basic premise of this, without getting into specifics, because it's a lot easier going to specifics if I get you guys on the bikes, but you're going to increase the resistance throughout, right? I mean, what we do on these, we either increase, like, on the treadmill, you increase either incline or speed or both, or on this one, you increase the resistance, and they have to keep that rate. So we do it until we get to, they can't do it anymore. We're at about 85% of their age predicted max heart rate. Again, from there, we try to figure out, it's kind of a little bit of a guesstimation unless you actually have a VO, like you can hook them up to a spirometer, but anytime we're doing the heart rate thing, it's not exactly accurate, but it works pretty good. Again, age predicted max heart rate is going to be their 220 minus their age. So again, for a 20-year-old, 200 is supposed to be the max heart rate. And then we translate max work rate into estimated VO2. Again, it's a estimation, right? So this is just giving you the heart rate versus power work rate. Arm ergometer, again, like if you have somebody that, say they're a paraplegic and they can't use their legs, this is going to be a better way. Or if you have somebody that's got an injured leg or injured legs, you can do this one. Again, you got to realize arm ergometry is a lot harder than people think, because these are muscles we don't tend to use like we do our legs. You'd be surprised. So again, it's like a bike, right? It's like a cycle ergometer for the arms. Again, same theory going through this. I don't want to go into all the details without actually, we'll do that in labs, but muscle strength tests. So we're looking at max force. So 1 rep max on basically any muscle or muscle group you want to do. 1 rep max bench. Again, I'll take you guys through how to do everything, but you want to warm them up without wearing them out, basically, right? And again, you don't want to go from like just really light warm up and then like load up you kind of want to work up just a little bit, but again, you got to try not to fatigue them during the warm ups getting to the max. Okay. And then once they get to where they think their max is, they may do it and be like, they can knock out like, oh, I did 2 of those, maybe, and maybe they could have even done more, but don't, like if they can do a lot, like say they do 1, if they're like, man, that was pretty easy, and they know they could have done 2, they don't need to do 2, they don't need to do 5. They don't need to do those things, because again, we don't want to wear them out while we're trying to figure out their max. Okay. So again, we want them to allow recovery period of 2 to 4 minute rest in between each set. So, or, each set is basically a rep is what we're going for in those sets. So 1 rep, but we're going to increase or decrease the load to try to get what their max is, right? Leg press, again, leg press is safer than doing a squat. Squats, 1 rep max squat is hard to do. You've got to have you need a team of people to do that. Properly. You need to have somebody that's standing behind the client, 2 people on the side to help rack and everything else in case they lose it. You need like at least 3 people to help to make sure they don't fall and get hurt. So leg press is a lot better, but same theory with the leg press. And again, you're going to load it up, and you're going to do some warm up, then load it up, so on and so forth. Partial curl up test, muscle endurance. Again, you've got to mark where you want their fingers to go to, and they're going to extend. So knees are flexed at 90 degrees. You're going to do we do the tape. First is 10 centimeters, 4 inches away from where the fingertips are, so on and so forth. They do a metronome, 50 beats per minute. So they're going to curl up forward, lifting shoulder blades off exercise mat by flexing trunk 30 degrees in time with the metronome, and avoid flexing the neck. So they're going to basically go to a metronome. The other thing you can do is you could do how many sit-ups they can do in a minute. You could do how many push-ups they can do total, so on and so forth. They're all ones that you can do, right? Flexibility, again, looking at range of motion. So different ones, you could do just a full-on range of body or range of motion using goniometers on all the joints if you wanted to, and measure it against, what's the normal ranges. The other one we can do is a sit and reach. Typically in fitness, this is what we do because it's one test. It doesn't take a lot of time. Again, you don't want them to do this one cold. So again, if this is one of the first tests they do, have them like maybe warm up and do some stuff, because if you're stretching cold muscles, you're not going to be at your full flexibility, one, and two, if they really try to push it, they could tear something. So again, back scratch test. Did they have a picture of this one? I thought they did. Let me see. This is the one, if you've ever seen this, where you're trying to I'll go back. I don't really want to go through all this test, but okay, well, so we'll go forward. Anyways, just kind of, you guys can go through this and look, but the back scratch test, this one where one arm comes up and over. So say my right arm is reaching back behind my neck. My left arm will come up behind my back from the lower part, and it's where you try to touch your fingers together, right? You can do it one way or the other way, basically. Okay. And you're looking at, how close the overlapping distance between tips and middle fingers and so on and so forth, right? So, and there's a few different ways you can do the back scratch test. That's the most common one though. BMI, again, in fitness, we don't really use the BMI as much because usually you're going to have things like calipers or like a BIA or you may have a bod pod. I don't know. If you're lucky, you may have a DEX or hydrostatic weighing, but we typically have, bioelectrical impedance or calipers. So we're usually not going to do the BMI. Usually, typically BMI is just what we usually do that at doctor's offices and things like that because they're just going to do the height and weight, right? Again, body mass index is not the most accurate, but it is what it is, right? Waist to hip girth ratio, again, not really something we do in the fitness. We usually will get the actual body fat percentage measurement. So again, here's skin fold. Again, this is only as good as the person doing it. Again, you can do the 3-site or 7-site. 7-site's going to be more accurate. Again, we'll go through this in more depth when we actually have a lab together to do it. The BIA, bioelectrical impedance, again, depending on the BIA, you have the little handheld ones aren't the most accurate. The in-body, 720s where you step on them and all that are a lot more accurate. Again, I like these better than the calipers because, I mean, if you have, some phys students that have done a lot of caliper pinching, they're pretty good. If they've had good instruction on how to do it, but most people don't have good instruction on it. So this kind of takes away a lot of the human error, right? Again, we don't usually use the ones that have the electrodes. So, yeah. Most those are kind of the old school ones. I haven't seen those in years, to be honest. Yeah, we can do balance tests like neuromuscular assessment tests and things like that. Again, you may want to do this with folks that either they have some issues that they need to improve and or could be worrisome, or if you have athletes that rely on their balance stuff and they need to, like you want to have a baseline and how they've improved over time. So again, I'm not going to go in great details with all the tests that they're listing on here. but you know, we can go through these in lab, and then it's a lot easier to do these as an in-person type thing rather than me speak through them, because you may not be able to picture it. Again, it's great if you have the book, because you can go through the book. I'll show you the pictures as we go through this stuff. Again, another functional performance test. This one you may not see very often. It's not one that, you know, we're getting into some that, you know, like with some general pop or some folks that may have some issues, you do some things with. Most of the fitness functional performance tests that I use are a little bit more on the athlete side of things, but again, some of the things that you do, some people might not be able to physically or mentally do. So you just got to be aware of which tests might be problematic and stay away from them, or try to revise them somewhat for them. Again, you know, there's a lot of different tests that we can do, right? 6-minute walk test. You know, you may have some folks, you know, I mean, just depending on how bad a shape somebody's in or other issues and things like that, versus doing running test or you know, cycle test. 2-minute step up test. You know, these are, we have a lot of standards, and you can create standards, to be honest. You know, if you realize, like, I got this unique person, here's a test I could actually do, you know, and if you do it on enough folks with the same issue, you can start to build, you could actually start to build some norms and things like that. And, you know, you could be the next person and maybe have a test named after you for discovering it. So 30-second chair stand test. Again, these are getting in more simplistic things for folks that have more issues. Again, arm curl test. Chair sit and reach. Again, we do a lot of these with folks that have a lot of physical, you know, the last few ones are all folks severe, you know, physical or neuro like limitations, things like that. Chairs again. SMART, you hear this a lot in our profession. And really, these are the type of goals you should do in everything, but specific, measurable, action-oriented, realistic, and time-bound, right? You know, sometimes people have these lofty, non-specific goals. It's hard to reach them if there's not a way to really, you know, be specific about what it is. Like, exactly what do you want? How do we measure that? So what actions can we take to get there? Is it realistic? Again, some people want certain body types that aren't realistic because their body, even at its best, isn't that type of body type, right? Some people, you know, like, yeah, you know, I want to be an NBA player and they're 5'2" and they're 60 years old. That's not realistic, you know. Um, you know, and again, you know, you don't want goals that go on forever. You know, you want to hit certain markers by certain times. Okay. Again, we'll talk more about SMART goals as we get into these other chapters, so we're not going to get really in depth in it. Again, make your goals, you know, very clear, specific. You know, you need to have things that are difficult but not impossible, because if they're too easy, you know, if they can already do it, then it's not a goal, right? But if you make it too hard, then it can detour them from working. You know, you got to kind of figure those things out. Motivation. Again, this is probably the most important thing. We need to motivate our clients, but our clients need to learn how to motivate themselves. And that's part of what you're doing. You're going to motivate them and teach them to be motivated, right? Again, typically people that feel like they can do something, you know, like have two things. There's two very important things, but there's a lot of other factors that go into it too. But the two, like, kind of very important things are, they realistically think they can do it. And they have enough, like, wisdom or on like, or, you know, like competence on the things that they're going to do to get there, right? And so again, a lot of times people may not have the competence required, right? And so again, you as a fitness professional need to educate them on how to do everything correctly. Not only that, but what they're doing, why they're doing it, you know, if they do it this way, what it's going to do versus doing it that way. Like they need to understand the ins and outs of all the exercises they're doing, why they're doing it, alternatives they could do, so on and so forth. Autonomy is met when the person feels that the decision to participate is made without outside pressure. So this is what they want, right? You don't want somebody coming in. It's like, yeah, my wife made me come. They're not going to make it. At some point, they need to own it. Okay. And then again, people that feel connected and appreciated by others, you know, like relatedness are more successful. But again, that one's not one of the most important, because some people are like, I don't care if I'm supported or not. I'm doing, you know, that's really what you'd like to have because people that don't need the approval or the support of others, they're going to get it done. But a lot of people need this one. Okay. And so if they're not getting it from other folks, again, you can, you know, you need to be the one they're getting that from. And again, if you can encourage other people in their lives to help out or help them, you know, create like a friend group at the gym or whatever else, it helps. Okay. All right, that's that for this chapter. A little bit longer of some of the chapters we do, but we'll do chapter 3 tomorrow.